Hi, this is Dr. G. I am the clinical director at Beginnings Treatment Centers, and I have been asked about the benefit of psychological testing. And this clip is going to be a brief explanation and summary what clients can expect from psychological testing and why we do psychological testing at our treatment center. Basically, the if you can imagine a person going through therapy, whatever form and fashion we want to call that therapy, for instance, psychotherapy or drug and alcohol abuse counseling, or any other type of treatment, it will take a person many weeks, if not months, to really come to terms with the core issues in their lives that they are struggling with. And what I mean by core issues is uh, really the understanding of the deeper understanding of a person's personality and strengths and weaknesses, their skills, their knowledge set, and their abilities to deal with daily life challenges. Now, in this specific case, when we're talking about addiction and substance abuse and alcohol and drug abuse, certainly we want to focus this discussion or this explanation on a person's ability to deal with their addiction. If you went through a few weeks or even months of psychotherapy, if you will, to come to terms with those core issues, again, strengths and weaknesses, and learn new skills and abilities to deal with one's addiction. Uh, Really, that is certainly treatment. It's called treatment, and it takes so many weeks and months to arrive at that type of a level of awareness, a heightened level or higher level of awareness for a person to be able to overcome those issues in their lives. However, psychological testing can shed some light on very core and underlying characteristics of a person within a few days. So, what we can understand as one of the primary reasons why psychological testing is important is, first of all, acceleration of awareness, acceleration of treatment, acceleration of tools within treatment that can help a person arrive at a quicker understanding of their what we call a constellation or personality condition. Now, I mentioned personality a lot, and that is the reason behind that is because a lot of psychological tests have been normed and standardized to really shed light on a person's personality. But it's not the only thing we are looking for. There are psychological tests that deal with what we call more or less acute mental health issues or mental health status of a person, such as, let's say, depression and anxiety. There are tests that can also show or indicate signs of, let's say, ADHD or psychosis or bipolar uh, state of mind. And also, there are psychological tests that really can shed light on more or less a thought or cognitive functioning of a person to help understand their intellectual abilities in dealing with these difficult situations. There are a series of other psychological tests available as well, such as those that can show neurological disorders, organic damages, if you will, or developmental changes or deficits or damages to a person's brain or mind. And also there are psychological tests that can show what we call more or less hidden or covert elements of a person's functioning, which really tap into more the subconscious or the unconscious aspects of a person's way of thinking or believing or reacting in the world. So we are really dealing with a whole armamentum, if you will, a whole series of different varied tools in psychological testing that range from intellectual ability, cognitive abilities, emotional abilities, behavioral abilities, personality tendencies, social abilities, even downright to, I would say, vocational abilities, a person's ability to really become a functional member of the society in terms of their ability to hold a job, to build a career, and even develop certain specialties if they wanted to. So with us being able to get that snapshot of a person's weaknesses and strengths quickly, right from the get-go, from the beginning of their treatment, we are able to do a few things. Number one, the results of psychological testing are very tangible and immediately available to the client himself or herself. It's a very standardized and basically logical understanding and a summary of the findings of the test that they went through that categorizes a lot of these weaknesses and strengths in a comprehensible and understandable fashion, where a client can quickly see what is going on more or less underneath the surface. As an example, if a client, let's say, finds themselves in certain predicaments in social settings where they mostly get in trouble with, let's say, authority figures, or with breaking norms and rules and regulations. And they have a hard time grasping where that comes from, whether or not that is something that has to deal with their personality, with their preferences, maybe neurochemical imbalances in their lives, maybe with their childhood, with their upbringing, with the education they have received. We can rely on some of these psychological test results to immediately shed light on that and help a person understand what area of their life and of their functioning they need to focus on. So it's a very accelerated, quick, tangible, reasonable, understandable, comprehensible way of getting to the depth of a person's functioning and relating to reality around them, and quickly coming to terms with some solutions as well. That is the role of a psychologist who would sit down with the client, and that's what I do on a daily basis. I sit down with my clients after they have gone through a battery of psychological testing. We make those test results understandable and we provide explanations to our clients so that they can make sense and meaning out of those testing, and so they understand themselves better. After a few, I would say, couple of weeks of going through a series of tests that may include up to about 10 different tests, but as little as maybe 2 or 3 tests, clients have a much better understanding of those underlying conditions. And with the explanation that we provide, they can get to work on themselves in a much more refined, focused fashion, where there's less doubt and confusion and vagueness, and more clarity and guided instruction, if you will, to address their issues while they're in treatment. So they can take these lessons from the psychological tests with them into the groups that they interact with, into their individual therapy, into their living situation. And the other benefit to this, beyond what the client can do, is also for the treatment team to understand the very unique characteristics of that client that has gone through the psychological testing, so that the treatment team also can come up with a very customized and personalized treatment plan that is unique and tailored to the very specific needs of that particular client, and again help them grow and make progress through their treatment protocol. I hope that was a good explanation for the reasons and the benefits of why we engage in psychological testing. There are only a few centers really within the addiction treatment field that engage in such tests because it is at times cost prohibitive, it is time consuming, as well as the requirements, licensing and credentialing requirements that are needed necessary to perform psychological testing. And if you have any questions, feel free to reach out to us. You can reach out to myself via our website. There's my email and telephone number available if you would like to find out more about psychological testing and their benefits for yourself, your loved ones, or anyone that you would like to benefit from treatment. Thank you.